here at the OneMedForum, and I'm joined now with Jim Marino from Trinity Orthopedics. Jim, thank you for joining us today.
Thank you, Alicia.
And you started up NuVasive. Why did you decide to go with another startup relating to a spine-related device? Why do another one of those?
Sure. Well, in part, my clinical expertise is primarily in the field of spine surgery, and I think I have additional expertise in the application of minimally invasive techniques with respect to spine. And although NuVasive certainly accomplished many objectives, there were many that remained unfulfilled of my own that I wanted to pursue, and Trinity is the vehicle for pursuing those objectives.
And there have been other startups in the same kind of field. How is Trinity different?
Well, in large part, we all aspire to do the same thing. We all are trying to improve the outcomes of surgical techniques, and in particular minimally invasive spine surgical techniques. Perhaps the most differentiating feature with Trinity's technology is that we're trying to utilize fusion technology to achieve better outcomes. Most of the latest technologies in the last 5 years or 7 years have been primarily directed toward motion-sparing technologies.
And give me a sense of what phase of development you're in right now.
Our company has products that have been fully developed and fielded and are in initial clinical release, and we have FDA approval for these products, and they've been used in a number of centers and in quite a few patients. But we're certainly at the earliest stages of clinical exposure and revenue generation in our early products. Some of our follow-up products, which are still in the late stages of development, we anticipate will undergo regulatory scrutiny within the next year or so.
Okay. And you're here presenting later today.
Yes, I am.
And hopefully to investors who may be interested in your products.
That's the objective here, yes.
If you were to secure funding, how would you utilize that?
Well, several things. The company needs to build out fully the infrastructure necessary to support clinical sales, which will take a fairly large percentage of the money we hope to raise. And then essentially the other portion of that money would be dedicated for new technology that has been developed through prototype but needs to be brought to clinical practice through a regulatory path. And we expect that process will take 2.5, maybe 3.5 years.
Okay, Jim. Well, thank you for speaking to me about your company. It was nice to hear more, and good luck with your presentation.
Thank you, Alicia.